First, what would you do if a terminally ill friend or relative asked you to help them end their life? A retired pathologist has sparked a national debate about the practice of physicians-assisted suicide.
Well, I took this first step in this campaign of what I call a rational policy of planned death.
It was a year and a half ago when Dr. Kevorkian provided his suicide machine to 54-year-old Janet Atkins of Portland, Oregon. Atkins suffered from Alzheimer's disease and killed herself using this machine. Dr. Kevorkian has been charged, or was charged, with first-degree murder. The charges were later dismissed because Michigan has no law against physician-assisted suicide. Kevorkian is back in the news after two Michigan women ended their lives using two of Kevorkian's suicide devices. In a taped interview with Kevorkian the night before their deaths, the women discussed their reasons for committing suicide.
Hi. Long time. Yeah, I have. And I have no qualms about my decision.
Do you have any fear at all about what you're asking?
I'm a little nervous. I have no fear of it. I'm a little nervous because I've been waiting so long.
On the phone is Geoffrey Fieger. Geoffrey is Dr. Kevorkian's lawyer. Good morning, Geoffrey.
Good morning, Eileen.
Can you clarify for us, did Dr. Kevorkian assist or did he advise in the deaths of these two women?
Both.
Both. Did they use his machine?
Yes.
Wasn't the state of Michigan pretty adamant about his not using his machine again?
No. In fact, the state of Michigan is like most other states, including Washington, which will vote on Tuesday. And an overwhelming majority of Michigan residents believe that it is an inalienable right of a citizen to decide these issues in conjunction with their family and their doctors when faced with terminal illness, debilitating disease, or intractable pain. The intrusion by a government into these decisions to increase or perpetuate suffering is intolerable in the minds of most people. That's why the Washington ballot is likely to pass, and that's why fringe groups here who seek to impose their morality upon the majority will fail.
Your client faces murder charges.
Theoretically, because we have a certifiable loon prosecutor who thinks he's doing God's work by stopping people from making their own decisions about life and death in the face of these terrible illnesses. Frankly, he would treat animals better than he would treat people, and it's quite astounding.
He also faces losing his medical license.
Yeah, I don't think either one of those will happen, and I think the idea of a jury convicting Dr. Kevorkian or anyone like Mr. Harper here, who came from California and actually produced the death of his wife by placing a bag over his head, how unfortunate that may have been, because frankly Dr. Kevorkian would encourage it to be done in association with medical doctors and not privately in one's home by family members. I just don't think that there's going to be any possibility that a fringe element of society is going to prevail in this.
Well, that brings us to the point that he has asked for a blue ribbon panel to take a look at this issue. I presume that's a panel of physicians to set out some guidelines.
Physicians, clergy, lawmakers, so that guidelines such as the ones that are going to be voted on in Washington can be instituted. Obviously, Dr. Kevorkian recognizes there's a potential for abuse, and that's why strict guidelines have to be established by society. But first of all, there's got to be a recognition that this is a right, and then guidelines have to be established. The debate about whether people have the right to decide these issues has got to be put aside. We can't have a very vocal but small religious minority or moral minority attempting to put over their views on other people. Once that's set aside, it's going to be very easy for rational people to get together and make strict guidelines regulating this. And I might add, the hysteria about some state becoming a death state or a suicide capital, that's just ridiculous. Holland has allowed it for years. 5,000 deaths in the Netherlands take place every year, and nobody thinks about a country in Western Europe such as the Netherlands as the death state.
All right, stay with us, Geoffrey, and
Thanks.
let me introduce the two people who join us here in the studio. Nancy Dorfman is the chairperson of the Greater Boston Hemlock Society, an organization that promotes the rights of individuals to choose how and when to die. And Dr. John Delfs is the director of the Elder Care Program at New England Deaconess Hospital and the principal developer of the Massachusetts Healthcare Proxy legislation. Good morning to both of you.
Good morning.
Is Dr. Kevorkian the angel of mercy, as some suffering patients have called him, or as one doctor put it, Is he a betrayal of the deepest meaning of the art of healing?
I think that, that contrary to what this gentleman on the telephone has said, that in fact Dr. Kevorkian is on the fringe. There's not a question about how much desperation there is out there. There's not a question about how much concern there is about suffering and about the dying process and about dying in pain or dying hooked up to machines that prolong your life and your suffering needlessly. The question is, how do we respond to that desperation? Do we do that by killing as a final solution and a simple and a take care of it all, or do we look at the harder and more important patient rights issues of access to health care and access to treatment for suffering?
Nancy, I want you to jump in here, but let's just speak to Marjorie Wands, who was the woman who was suffering with a pelvic disease, who was one of the women who committed suicide this past week. She said that her doctor accused her of overstating her pain. That seems to me to be a critical issue. If a doctor does that, and then clearly the doctor is not treating the pain properly. Is that an issue?
Absolutely. We need access of people like this lady to qualified experts who will take her pain seriously and treat it. Again, the solution is treating the pain and suffering in a way that does justice to the dignity and worth of this person and her suffering.
Sure,
but
Geoffrey.
Just respond.
But not to kill her.
That statement is born out of ignorance. Marjorie Wands was operated on 10 times at the Mayo Clinic, at the Cleveland Clinic, at the Sinai Hospital here in Detroit, and was treated by the best experts in the world, including, finally, Dr. Finn of the Hospice of Southeast Michigan, in giving overwhelming dosages of painkiller, similar to that would be given to terminal cancer patients, and in dosages exceeding that, and there was absolutely no relief. There are patients who, despite the best intervention of medical care, have no relief. And to suggest that simply because some patients will respond, the fact that other patients won't, they have the right to decide. And this woman wasn't mentally incompetent. It wasn't like she hadn't exhausted every possible medical remedy. But when all else fails, they have that right.
Let's jump to Nancy here. Do you agree with what Geoffrey Fieger is saying?
Well, I agree with both of these gentlemen. We certainly need much more attention to pain control and making dying patients comfortable, but we also have to recognize that there are many patients for whom this kind of care either is not forthcoming or isn't possible, and I think we have to address their civil rights, their right to control their lives and make their own decisions about dying.
Isn't even the Hemlock Society worried about abuses?
Well, I think we're worried about abuses right now, with or without a new law. 80% of patients who die in hospitals today die as a result of a decision to allow them to die. There are many opportunities for abuse right there. But I think that what Dr. Kevorkian has done, without supporting him or criticizing him, because I don't think I know enough about the case, has brought to the attention, once again, of the American public, the need for an orderly process which will permit patients to go to their physicians, request aid in dying, and receive it when their need is great enough.
And how will the medical community respond to that need if they agree with what Nancy just said?
I hope that the medical community responds by treating the suffering, even if the treatment of the suffering hastens death, if it's difficult enough to treat the suffering. I think there's a broad consensus in the medical and in the bioethical and medical ethical and religious communities that treating suffering is a primary and very important role of physicians and of our healthcare system. Even if treating that suffering means that a person then lapses into coma and ultimately that their death is hastened, there's a consensus on this. There's not a need to put another and very dangerous role into the healing profession, which is the role of killing.
We're back with Dr. Kevorkian's attorney, Geoffrey Fieger, on the phone. Dr. John Delps from New England Deacon is here in the studio, and Nancy Dorfman with the Hemlock Society. You were just saying during the break, Nancy, this is a very rare person who would use the physician-assisted suicide if it existed legally in the country.
I'm quite certain, on the basis of Hemlock's contact with people who are seeking a way out, that those who have it rarely use it. I've had conversations with many surviving spouses and children who said that they never used the drugs that they had gotten from their physician in the end, but it meant enormously to the patient to know that they had control, that if they needed these drugs, they would have them.
So in other words, it relieved them of desperation?
Yes, it did.
And
I think that that's a very, very telling comment. I think it would suggest that if by knowing you have the control and of a relief of your desperation and of some hope, that then your life is better, that your suffering is no longer there, that it means that we don't have to move to a terribly dangerous solution of killing, that we rather can address the hopelessness and can address the suffering and can address the control. I believe that to frame this in patient rights is accurate, but that we lose our rights once we go over this bounds and begin to have killing as a solution. The solution to the patient's rights struggle is to give the patient control, to not be put on machinery to keep them alive, to give them control to work with their physician to relieve the pain, to give them a healthcare system where they have some access, where we don't have 40 million people who are out there in desperation because they don't have any health insurance.
Jeffrey, let's give you the final word here.
All that the doctor just said is accurate, except in the cases where there is no solution and where there is no hope, his final statement that this constitutes killing is his imposition of his own personal values upon other people. And that's the difference between him and Dr. Kevorkian, I believe, in the Hemlock Society. And it's that feeling that killing is wrong, rather than killing is a final act of medical solution in a hopeless patient, that we diverge in opinions.
Well, it has been mentioned, but in 2 days, the state of Washington asks its people to vote on an initiative that will allow physician-assisted suicide. It's Initiative 119, so watch your newspapers and your newscast for the results on that. Clearly, one of the biggest, newest civil rights issues of our decade, and something that will be talked about a great deal. I thank you, Nancy and John, and thank you, Jeffrey, for joining us this morning.